12 weird signs of low oxygen levels in your blood. Oxygen is essential for the proper functioning of every organ in your body. When your oxygen levels drop, it can trigger a range of symptoms, some of which are subtle or unexpected. Hypoxemia, or low blood oxygen levels, can occur for various reasons, including lung diseases, heart conditions, or even environmental factors like high altitudes. Recognizing the signs of low oxygen levels early can help prevent serious complications. Below are 12 unusual signs that your oxygen levels may be too low. 1. Cyanosis, bluish tinge to skin and lips. Cyanosis is a classic sign of low oxygen levels. It occurs when the oxygen content in the blood is insufficient, leading to a bluish discoloration of the skin, lips, or fingertips. This is most noticeable in areas with less blood circulation, such as around the mouth or under the nails. If you notice this color change, it may indicate a significant drop in oxygen levels and should be treated immediately. 2. Unusual fatigue or weakness. If you feel an overwhelming sense of fatigue that doesn't go away with rest, it could be linked to low oxygen levels. When the body isn't receiving enough oxygen, it struggles to supply energy to muscles and organs, causing a general feeling of exhaustion or weakness. This fatigue can be unexpected, affecting your normal daily activities. 3. Shortness of breath, dyspnea. Shortness of breath is one of the most common signs of hypoxemia. If you're experiencing difficulty breathing or feeling winded even when performing low-effort activities like walking to the kitchen, it might be an indication that your body is not getting enough oxygen. This could be due to lung or heart problems, or it might occur when you're in high altitudes. 4. Confusion or difficulty thinking clearly. Your brain needs a continuous supply of oxygen to function properly. Low oxygen levels can impair your cognitive abilities, leading to confusion, difficulty concentrating, or memory problems. If you suddenly find it harder to focus or seem unusually forgetful, it could be a sign of hypoxemia. 5. Rapid heart rate, tachycardia. When oxygen levels in the blood are low, the heart has to work harder to deliver oxygen to the organs. This can cause an unusually fast heart rate, also known as tachycardia. If you feel your heart racing or thumping in your chest without physical exertion, it may be related to inadequate oxygen supply. 6. Headache. A headache is another symptom often associated with low oxygen levels. If your brain isn't getting enough oxygen, it can trigger vascular headaches. You may also experience a sensation of pressure or tightness in your head. Sometimes, a headache might be accompanied by dizziness or nausea. 7. Poor coordination or dizziness. Low oxygen levels can affect your nervous system, causing problems with balance, coordination, or dizziness. This can make you feel unsteady or lightheaded, especially when standing up or moving quickly. If this occurs frequently, it may be a sign that your blood oxygen levels are dangerously low. 8. Morning confusion or restlessness. Waking up in the morning feeling disoriented, confused, or agitated might indicate a sleep-related oxygen deficiency. Conditions like sleep apnea cause oxygen to drop while you're sleeping, leading to cognitive disturbances and physical discomfort upon waking. This can be worsened by a lack of restful sleep due to frequent awakenings during the night. 9. Increased blood pressure. Low oxygen levels can also trigger a rise in blood pressure, particularly in the lungs. When the body senses a lack of oxygen, it constricts blood vessels to prioritize oxygenation for vital organs like the brain and heart. This can lead to pulmonary hypertension, high blood pressure in the lungs, and cause further complications. 10. Cold or sweaty extremities. As your body works harder to circulate blood to vital organs, blood flow to the extremities, hands, feet, may decrease. This can cause your hands and feet to feel cold, clammy, or sweaty, despite the temperature being warm. This can be especially noticeable when oxygen levels drop suddenly. 11. Restless sleep or frequent waking. Those with low blood oxygen may experience interruptions in their sleep cycle. You may find yourself waking up frequently during the night, feeling restless, or having difficulty falling back asleep. This happens because oxygen deprivation triggers the brain to awaken in an attempt to restore breathing. 12. Chest pain. Chest pain in the presence of low oxygen levels can be alarming. If oxygen isn't reaching the heart muscle efficiently, it can cause chest discomfort or pain, which could feel like pressure, tightness, or a sharp stabbing sensation. This is particularly concerning as it may indicate a more serious underlying condition like heart failure or a lung disorder. When to seek medical attention. If you notice any of the above symptoms, it is essential to seek medical advice, especially if they occur suddenly or worsen over time. Low oxygen levels can lead to life-threatening conditions if left untreated. A healthcare provider may conduct blood tests, an oxygen saturation test, or imaging to assess your oxygen levels and determine the underlying cause of the symptoms. For those at risk, including individuals with lung or heart diseases, it's crucial to monitor oxygen levels regularly, especially if you experience any of these signs. Oxygen therapy, medication, and lifestyle changes may be required to manage and restore normal oxygen levels. Recognizing the signs of low oxygen levels in your blood can be tricky, as some symptoms are subtle and easy to overlook. However, paying attention to unusual fatigue, shortness of breath, confusion, and other odd signs could help you catch a problem early. If you suspect your oxygen levels are low, don't hesitate to seek medical attention to ensure your safety and well-being.